How many doctors do we need in the United States? I think that's the wrong question to ask. I'm Chad Swanson, and I'm an emergency doctor. I'm also on a personal journey to understand and transform our health system. Up till about 2016, there was only one medical school in the state, in my state, in the state of Utah. Since then, there's been two more, and another one was just announced. That got me thinking, how should we decide how many doctors there should be in our society, and who should decide? The Association for the American Medical Colleges estimated that by 2034, we will need between 37,800 and 124,000 new physicians. They came up with those figures by considering a number of factors, ranging from when doctors might retire, when they might quit and move on to a different profession. They considered what roles physicians' assistants and nurse practitioners and other health professionals might play. They considered the role of pandemics like the COVID virus. I think that the way that we approach this is deeply flawed, and we need to think about it differently. Let me share my reasons why. First of all, to make my point, I'll share a challenge I've been dealing with, and that's with my lawnmower. So recently it hasn't been working as well, and to figure out what was going on, I've taken the filter off, and there's an engine, and I don't know much about lawnmowers, but there's a muffler and some other parts. And so if we think of the health system kind of like a machine, like a lawnmower, then we might consider, well, if we have a certain number of hospitals and a certain number of doctors and a certain number of nurses and a certain number of respiratory therapists and all the other various professionals, if we get the right number, then we'll be able to deliver the services or improve the health like we want to do. There's many flaws with this approach. The greatest, I think, is that the parts in a health system are human beings. So we have feelings and biases and assumptions. We also change over time. We as human beings change, our organizations change. The challenges that we face as a society changes. There's pandemics that emerge, there's wars that emerge, climate change happens. The other flaw is that for physicians, there's a lag of about 7 years, at least 7 years, from the time a student enters medical school until they finish residency. So if you can imagine, if I went to order a muffler for my lawnmower and there was a delay of about 7 years, then I might have moved on to an electric lawnmower or something else. To make that point, if you could imagine creating or producing a phone with a cord on it, a phone cord, those used to be ubiquitous before wireless phones. And so if it took 7 years to figure out how many cords we might need for our telephones, then that just wouldn't make sense because things would have changed. Now, of course, our healthcare system is much different than the manufacturing of phones, but I think there are some lessons to be taken away. Let me just share an example, and this is something that's happening across the country right now. So right now there's approximately, I guess, 385,000 nurse practitioners and 178,000 physicians assistants in the country right now, so over 500,000. And many of those have been in practice, seeing patients, many independent, either completely independently or mostly independently. And they've gained tremendous knowledge and experience and skills through their healthcare practice. if one of them wanted to become a physician, they would need to go back to medical school and do an entirely new residency in order to practice as a physician full-time. That just doesn't make sense. So when the profession of physician was initially established in the 1840s and 1850s, and then it solidified in the 1880s and 1890s, the world was a much different place. The level of education of people who wanted to become physicians were different. The diseases that people suffered from were different. And so it's a much different world today. The biggest difference is probably the way that we learn through the internet and artificial intelligence now coming up. And so there are tens of thousands, maybe even hundreds of thousands of healthcare professionals that could and may want to become physicians that wouldn't require the full 7 years. They might require 1 year or 3 years, but certainly not the 7 years. And so in order to meet the needs for physicians, we could rely on our healthcare providers that already have years, even decades of experience on the ground seeing patients. Now that would require a complete overhaul of what it means to have a medical school. It would require a new licensing requirements. So the scope of practice of a healthcare professional would be based more on competence than it would be on the conventions that we've inherited from decades, even more than a century of experience. So the way things work now, let's say that this circle represents medical schools, and the focus of the medical schools is to educate that physicians that could excel in the current system, while all these other circles represent other subsystems within our larger health system. What I'm suggesting is that we need a system that is more adaptive, that's more nimble to meet the needs of our society. So we need an education and licensing and credentialing system that meets the needs of professionals that already have experience, that already have knowledge. So I imagine, for example, a family practice nurse practitioner with 20 years of experience who has excelled in her knowledge of practicing medicine, who has over the years become as proficient as many of her physician colleagues, who has learned the skills and procedural skills to perform well as a family practice healthcare provider, and who has the confidence of her patients and receives very positive patient feedback. So I would imagine that this healthcare provider with that much experience and that much knowledge and those skills might require 1, maybe 2 years of additional pathophysiology knowledge or ICU experience. But I think the full 7 years adds inefficiency to our system. So if you can imagine an entire education and credentialing system where any provider at any level could move, for example, perhaps a family practice physician towards the end of her career could become a psychiatry physician's assistant, if that's what she wished to do, or an anesthesiologist could become an emergency physician, and only the number of years that would be required for training and education to reach that level of competence would be required. So this is a thought-provoking video that I've produced today as a part of an informal conversation, because I think that there needs to be more discussion about transformational change in health and medicine. I'd love to know what you think. Thank you.